if the laws of a country could influence someone's health choices, even their sexual behavior. A new global study in social science and medicine used data from the global LGBTQI plus happiness survey covering nearly 70,000 sexual and gender diverse participants in over 180 countries to test exactly that. This new study examines the complex links between different dimensions of homophobia and HIV risk sexual behavior among gay, bi, and transgender people around the world. Sexual and gender diverse people face stigma, from discriminatory laws to local violence, workplace discrimination, and rejection from family. Researchers wanted to understand how does structural homophobia, meaning anti-LGBTQ+ laws and hostile societal attitude, shape HIV risk? The results are striking. Where structural homophobia is higher, meaning criminalizing laws and hostile social climate, people report more violence and discrimination, more verbal and physical abuse, more workplace discrimination, and more rejection at home. The study also highlights that these effects are even stronger in countries with weaker civic space. And crucially, those same environments are linked to higher level of HIV risk sexual behavior. For example, unprotected anal sex with casual partners. The study also helps explain the pathways. Discrimination doesn't just violate rights, it increases stress and insecurity. It can shift people's general risk-taking, which then increases HIV risk behavior. This matters because it reframes risk. HIV vulnerability isn't only about individual choices, it's also about the system people live under. In Africa, same-sex relationships are still criminalized in 31 countries out of 54. When punitive law normalize discrimination, they create fear, secrecy, and marginalization. These conditions can push people toward a higher risk behavior, not because they're responsible, but because they're coping with hostile environment. The key takeaway is simple. If we want to reduce HIV transmission, we have to address structural homophobia. Protecting rights isn't just about equality, it's a public health strategy. Ending discrimination saves lives.